Hey, this is Dave Mason, and I am here with Dr. Diane Grice. And Dr. Grice is actually my doctor.
Well, thanks for taking the time to talk with me today. I'm excited to have this conversation. This is something that many people feel really lost with because people are put on these medications without truly understanding just how difficult they are to get off of. And they are very effective at what they do. They can be short term, as far as calming the anxiety, helping people sleep, but it's clearly a very outside in kind of treatment. And therefore, that makes it very, very challenging to get off of if the underlying imbalance isn't really addressed. And that's something that conventional medicine doesn't spend a whole lot of time and energy in trying to treat or work on that underlying stress response and tone of the nervous system that influences these symptoms. And so I feel that my job is to make sure that the patient is supported by with different practitioners. Therapy is something that is going to be needed getting off of these medications. As you said, every single small little step down in the milligram dosage is going to create some rebound symptoms for most people. That might be mental emotional symptoms, it might be sleep disturbance, appetite changes, as well as things from severe pain, headaches, muscle spasms, things like that. So you want to make sure that a good support system is in place as far as different practitioners, therapists that can help provide that support over time. But I think the most the way to do it in the most advantageous way is to really build up the person a little bit from the inside out, even before you start to taper, making sure their nutrition, they're eating well, they're digesting well, they're eliminating well, maybe supporting with some vitamins and nutrients that we know these medications deplete, which is, there's many that also further compound and affect the mood, like vitamin D, for instance, with specifically for benzos. And so supporting the system by using vitamins and minerals to make sure that the body is in the best possible state to be able to taper off. And so that might take a few months before, and that, while they stay at that same, milligram dosage of that Xanax, really building them up from the inside out so that then once we start that taper process, their body is just much more in balance so that we could create less symptoms. But as naturopaths, like you mentioned, homeopathy is a tool that I find to be very helpful to help balance both the mental, emotional symptoms as well as the physical symptoms, like reflux and bowel changes and the pains and things that can come up with these symptoms. And so
Mood.
mood, yes, very much so. Dealing with changes often, when we're treating anxiety, there's often anger underneath there. It's same thing with treating depression. Very, very often there is unresolved grief, unresolved anger. And so when you really start healing and taking away these suppressive medications, the true emotions start coming up. And that's why I find it's so important to make sure that that support system is in place because as that anger comes up and that frustration and those sleep changes, and you want to make sure that you have people to help support you and work with you and changing as you're changing, because with homeopathic remedies as well as with acupuncture, something that you found to be really helpful and that I see very often is because you're working on the physical body, you're able to get somebody out of their head and really gets them grounded. And it can also help, we can soothe the liver, which very much affects anger and emotions, which we see from the Eastern perspective. Um, this idea that there's liver stagnation that causes anger and that can lead to things like depression. But from a Western perspective, a lot of these medications that are used to treat emotions are really hard on the liver and cause liver qi stagnation. And so we can see and feel it in the pulses as well as in the Chinese tongue diagnosis, seeing signs that there's liver congestion. And the patient often, whenever we soothe the liver with acupuncture needles, they feel a tremendous relief of anger, frustration, just leaving the office in a matter of 30 minutes, feeling like a very different person. And I like that because, of course, it gets good results and it's pretty efficient time wise. And the other thing that I get from it, checking in with patients, like I did with you, working, on a weekly to every other week basis while you were getting off the medications, it gave me an opportunity to get my eyes on you and touch base on nutrition, making sure you were digesting well, you were eating regularly, you were sleeping okay, so that if there was some areas that needed extra support, of course, I'd work to address it through the acupuncture, but also we might fine tune the nutrition or add in a supplement that might help out or add in an amino acid to better support the mood. And
Or
so,
Kundalini yoga.
or the Kundalini yoga, exactly, adding in all these different things that are going to work together. And so I like that frequent touching base. And I, of course, wasn't the only provider. You were working with, counselor and getting other nutritional work.
Correct.
So having a team is the best way to do it, I think.
So while the taper may look linear, you're going to go from this week to this week and this week and this week. Anyone that's done a taper will tell you that it's a holographic event. It's not linear at all.
Yeah.
So one of the things that you need to consider if you've never experiencing tapering off of any of these kind of medications is that you are going to, I don't say, well, I don't, I know I did. I would have very mild to very severe rebound events. So you really need to have your structure in place or a plan in place, so to
Yeah.
speak, as to how you can cope with those feelings and emotions. You need somebody to call. You need to be cognizant of, yeah, you might have to go get some acupuncture right then and there because sometimes you get these feelings like you're climbing the wall. It is not comfortable. That's why
Mhm.
people, I think, from my own experience, have a hard time getting off of these medications because they don't have a plan. I found magnesium drips very effective.
Mm.
Um, the second time I tapered off of benzo, I was doing Kundalini yoga, very specific yoga kriya or series of poses to strengthen my navel point, which is about 3 fingers below the belly button. Me personally, I would recommend doing that for 40 days, uh, before you even considered cutting, and then continue, maybe increase it as you're coming off and visiting a health practitioner like Dr. Grice, because I think I was doing, as I was coming off the medications, I was going up, I was taking inositol.
Mhm.
I can't even think of some of
We
the
are
other things
doing
right
some
now.
lithium orotate, also
Yes.
just other kinds of calming nutrients that work similar to the calming effects of a benzo, but a very natural way. And so we were building those up internally. And yeah, that Kriya work that you were doing, it was a very noticeable difference. I could see within you the groundedness and feeling centered. And it also was very empowering for you because it was
Yeah.
something you were doing for yourself. It was your own time, your own breath, your own intention, not something a pill you were taking or going to an office visit. It was an active practice that you were making time for. And I think in the mental health world, we have to emphasize that autonomy and that self-care and those opportunities to really take, give ourselves the love that ultimately we're needing. And so and we're not feeling connected. And so I think of giving yourself good nutrition in the same way. It's an act of self-love and self-care. And by taking the time and thinking about what you're eating as just as important as the medication or the supplement that
I
you're taking.
changed, no, yeah, everything.
Yep, you,
And
you did a
it
complete
you had
revamp.
you had to. For
Yep.
me, I did.
Hmm.
Uh, yeah. So I think the point that I want to make, like, the first time I got off of a benzo which was Ativan, I had absolutely no idea what was going to be coming at me down the pipe, and it was a shock as to, at least for my own experience, how bad it felt, how alone, how it was scary. It felt bad. So really, having that plan in place is crucial to get yourself through it. And
Yep.
hopefully yours won't be as bad as mine was, but you just want to be ready. So we'll be talking about some other modalities in some other videos that we're going to do, because I have taught myself tools to deal with the stress, anxiety. There's rebound depression, and just to recognize those things, not make yourself wrong about it, not invalidate
Mhm.
yourself about it, because to some degree, your body is a mechanism, much like your car is a mechanism. It just does what it does. So you can either make your car wrong because it's pumping out exhaust, or that's just the design of it.
Mhm.
Or my body's doing what it's doing because that's what happens when you take something out. It's just going to do that. So it is a process. And uh, any last words, Dr. Grice?
I think that the important thing is just making sure that that you're really listening to your body. There's a lot of schedules out there for drug tapers, and many of them are really conservative. Like a 10% or so dosage, on a weekly basis. But for some people, that will be way too fast,
Yes.
and so I encourage a very very slow taper. A 10 or 15% decrease over a few weeks or something like that. But even for some, that might be too fast. And so the important thing is just to work closely with another health provider so that you're able to be supported and you're able to be successful with it because
Do
this it's
Yes,
just,
do
yeah,
not do it
very
on your
important.
own. The
Yeah, it's
first time I tried
not
to
meant
get
to be
off
done
of
alone.
these, I was not doing it correctly. And 2 days later, I
Yeah.
was on the ground in a ball, sweating, and my heart felt like it was going to pound through my chest. And I was climbing the wall. So, yes, talk to your doctor.
Yeah.
Do not do this off the internet. Dr. Grice, how do we get a hold of you?
We can put a link to my website, but yeah, I'm located in Tempe, Arizona, and so
Okay.
yeah, if I'm here locally, but there are naturopathic doctors across the country,
Yep.
and also medical doctors and DOs who are also working in a more integrative model. So that's the important thing, making sure you're really dealing with the foundation, supporting yourself so that you're able to nutritionally and make the amino acids that you need to make. And so that all comes down to the basic building blocks, which is nutrition, vitamins, minerals, and making sure that the digestive system can absorb and assimilate all of those nutrients. So working with a functional doctor or a naturopathic doctor would be likely set you up for good success, along with the psychiatrist, of course.
Okay. Well, thank you. And
Yeah, thank you for having me.
you're very welcome. And stay tuned. We'll probably be doing this again.
All
All
right.
right.
Yeah, I'd love to chat again. So, all right. Well, have a good rest of your day.